Simulation rooms. As a health profession student at Parkland College, you will participate in simulation in various areas of the college. Simulation may take place in a simulation laboratory in the main building, in a classroom, or in the Dr. Joanne Huff and Joanne McGrain Simulation Lab in the H-Wing. Each patient simulation room or area will be set up to provide the student with the supplies, materials, and equipment that is needed for the simulation case. Students should familiarize themselves with the location of the supplies and the capabilities of the room in which they will perform simulation. The following information will help students to become familiar with the simulation laboratories at Parkland. Equipment function. Some equipment used in simulation will be fully functional, while other equipment may lack fully functional. This will depend on the power source required to run the equipment and the simulator's capabilities. For example, some rooms have functional equipment, such as oxygen, while others do not. When working with the equipment that does not have full functional capabilities, the student should simulate proper use of the equipment. For example, if the student is putting the patient on oxygen, they will properly set up the equipment, but when it comes to setting the flow, the student should then appropriately communicate to the interdisciplinary team member what flow was set. Each simulation area will be set up with the equipment the student needs to successfully perform a simulation case. Some supplies will be in the room, in an area adjacent to the room, or in a Pyxis system. The Pyxis system is used in a lot of hospitals for supply storage and dispensary. This system is designed to keep track of supplies used for a specific patient. When using the Pyxis system in the hospital, students will enter in the patient name and then remove supplies from the system. Supplies can be taken in return for each individual patient. In the simulation lab at Parkland, students may use the Pyxis to gain access to supplies for some simulations. When taking and returning supplies, it will not be necessary to put the patient identification into the Pyxis machine. Please click on the link to become more familiar with the Pyxis system and supply locations. Medication dispensing. Medication may be dispensed in several ways during simulation. This will be depending on the drug and the situation. The medication cart. One way dispensing medication is by using a patient medication cart. Most previously ordered medication will be in this dispensing system. The cart has several individual drawers that are labeled with patient names. With this system, the student removes the patient medication from the drawer and then administers the medication to the patient. The tube system. Some medications may not be in the med cart and may require that the student order the medication or IV solution from the pharmacy. In this case, the student will receive the ordered medication through a tube system. Many hospitals use pneumatic tube systems to transport prepared medications and IV solutions from the pharmacy to the patient care area. In the simulation lab at Parkland, a two-way door will be used to simulate a hospital tube system. Hand delivery. Depending on the capabilities of the room and the product that is ordered, students may expect hand delivery. In the hospital, blood products are hand delivered from the blood bank to ensure the safety of the product and the timely delivery. This also may be the case with specialized medications and IV solutions. Control room. For every simulation, there is a controller. The controller is a health profession employee with significant healthcare experience. Usually the controller sits in a room adjacent to the simulation lab, but may sometimes be present at the patient's bedside, controlling the simulator's functions through a tablet device. For each simulation, your instructor has selected a patient case scenario. This scenario will guide the controller through multiple stages of the simulation. The controller will advance through the scenario, changing patients' vitals and conditions as the simulation progresses. The controller is also the voice of the patient, as well as all other departments the student may call. During a simulation, students may expect a short delay as the controller switches from role to role.